My name is Matt Winton, and I am the Senior Vice President and the head of the U.S. MS franchise at Biogen. This is the first in a series of videocasts we will share on important issues in MS. Today, I will be talking with Dr. Mitzi Joi Williams, a board-certified neurologist and world-renowned multiple sclerosis expert in Atlanta, Georgia. She has practiced in academic institutions, community clinics, and is the founder and CEO of Joy Life Wellness Group MS Center, where she and her team provide personalized MS care for patients in the region. Today we'll be speaking about the health inequities that many MS patients experience with regards to access to care, discrimination, bias in medicine, and clinical trial representation. So when we look at MS across the nation, not everyone has the same access to care and treatment. I want to start by discussing what you're seeing with regards to access to care for underserved and minority populations. How is access different for these groups than others?
Thanks so much for that question, Matt. Talking about access to care is essential to any conversation that we have about health equity. I have found in my experience that many of my African American patients have difficulty not only accessing specialty centers such as my MS Center, but also accessing general neurologists, which certainly can affect the types of treatments they may have access to, as well as their overall plan for their MS care. We also see this issue not just with marginalized communities such as African Americans and Hispanic Americans, but also with rural populations. And this is something that needs to be addressed desperately in order to improve outcomes in some of the populations where we're seeing health disparities.
Dr. Williams, how have you navigated access to care for your underserved patients living with MS? And what advice do you have for other healthcare providers who may be in a similar position?
So gaining access to care for my underserved populations remains a challenge, especially now during a pandemic where we are often having to do things remotely and don't have the ability to touch the patients and have them fill out forms, etc., in person. So I think that one way that we do this is really by working with a team approach. So we work with different members of our staff to get medications approved. If there are denials, we write appeal letters. We often work with our pharmacy colleagues and many others, as well as my colleagues around the U.S. who have experience with certain issues in trying to get the correct medication for the correct patient. Because insurance is so regionalized, my advice would be to reach out to those in your area. We really are able to work together and collaborate because ultimately our goal is to get patients the best treatment possible.
How is that playing out in impact to care? What are you seeing in these patients in terms of outcomes and their ability to live with multiple sclerosis?
We know that there are many studies that suggest that certain populations have poorer prognosis, meaning they have worse outcomes, more disability earlier on than other populations, and those include African Americans as well as Hispanic Americans living with MS. One of the big difficulties is that we don't know what part is due to social determinants of health, such as access to care, versus what part may be related to biology. In order for us to understand what's really going on in these populations, we need to make sure that people have access to the specialists who can give them those individualized healthcare plans to really care for their overall MS.
So in the case of patients from underserved communities who have encountered challenges in managing their MS symptoms, what has worked in helping keeping these patients on track with their care management?
I think the best thing that we can do is educate our patients and also teach them to advocate for themselves. So the one thing I always emphasize to my patients is that you are your own best advocate. So I encourage them to understand what's going on in the process, what the treatment plan is to the best of their ability, to involve other family members and care partners in the process so that they can help make sure that they stay on track, and to really build that support network. So that support network including their healthcare team as well as their care partners, and engaging with others in the MS community who really understand what's going on. And I found that's the best way to keep people on track with their treatment plans.
Dr. Williams, thank you so much for taking the time to discuss this important topic with me today and sharing your passion and valuable insights. I hope this conversation can help us all have a better understanding of health inequities faced by some people living with MS and what we all can do to address them. I hope all of you enjoyed today's session and will join us in the future as we continue to talk about important topics in MS.